In this video, Dr. Gattorno explains the role of interleukin-6 in the pathophysiology of JIA.
IL-6 is one of the most important pro-inflammatory cytokines. It's produced by a number of different cells from the innate and adaptive immunity, from endothelial cells, fibroblasts, chondrocytes, and exert a number of functions on different cells like hepatocytes, chondrocytes, B lymphocytes, plasma cells, osteoblasts, and so on. It's an example, a clear example of a potent pro-inflammatory cytokines that exert endocrine effects on liver, vessels, bone marrow, and different cells. There are clear evidence that it can able to exert its function in different aspects, immunopathological aspect of chronic synovitis, on the activation of macrophage, chondrocytes, and synovial fibroblasts, and the production of autoantibodies. IL-6 exerts its function through the binding of receptors, IL-6 receptors that can be bound on the membrane, all free on their circulation, and is very important the further link with GP130 protein to exert the activation of the cells with JAK and STAT3 activation. There is an elegant study from the group of Gennaro Siliberto some years ago showing that collagen-induced arthritis is not possible to be activated in mice that are knocked out for IL-6, showing the important role of these cytokines in development of experimental arthritis. And there was then plenty of study in rheumatoid arthritis and then also in juvenile idiopathic arthritis showing very high level of IL-6 in the sera and synovial fluid of patients with juvenile idiopathic arthritis. And you can see here a slide with the expression of IL-6 in the synovial tissue of patients with polyarticular and oligoarticular arthritis. But one of the most striking effects of IL-6 is seen in the systemic form of juvenile idiopathic arthritis, in which there are very high level of circulating IL-6 that correlate very well with disease activity, and also plenty of evidence, especially from the group of Fabrizio De Benedetti's group, showing that many aspects of a systemic onset juvenile idiopathic arthritis, such as anemia, growing impairment, and osteoporosis, are closely related to the role of IL-6. That lead to a specific strategy for anti-IL-6 also in juvenile idiopathic arthritis through the use of IL-6 inhibitors or IL-6 receptors inhibitors. That has been planned and performed during the last years and during the first years of the present century, with many studies that lead to the registration of the drug for polyarticular JIA and systemic onset juvenile idiopathic arthritis.